of those injuries are why most people go see a pain doctor. Now, there's two avenues to take. And society today likes one avenue way better than the other. We're going to discuss both real quick. The first avenue is the easy way. That's to take a pill, to get a prescription, to take a pill that's going to alleviate the distress of that injury or that degeneration. Okay? Now, not saying that's good or bad. Right now, we're just discussing what the options are. Okay? So they come in, they'll assess you briefly and say, yep, you got degenerative joint. This would take some x-rays, a CT scan or an MRI, and you're off to the races. We'll start lining up those prescriptions for you, left and right. And here you go. And how are you going to feel when you take the anti-inflammatories, the benzodiazepines, the muscle relaxers, the sleep sedatives, et cetera, et cetera? Well, you're going to feel a lot better than you did before, because before you were in anguish and distress and physical pain, right? So it's going to make you feel much better, and the euphoria of it too, the high that you get by taking it, is going to be a added bonus for a while. Okay? Yes, sir? What were we going to say?
I said it's chronic pain or...
Yeah. Yep. Any kind of pain. Any kind, especially chronic pain. So it's going to alleviate that chronic pain or even acute pain. Okay, and then it's going to give you the euphoric feeling, and you're going to be, wow, man, I'm more productive. I can go do that. So it's going to sound wonderful and feel wonderful. And your logic and reason is, wow, this is going to help me get back to where I want to be. Not in pain and productive and able to function, right? And for a while, it is. So in that context of the use of these prescription drugs, I'd say, yeah, that's a wonderful thing. Now, here's the problem. Here's where our plan falls apart. After about 3 weeks of use of these benzos, opiates, muscle relaxers, central nervous system depressants, what happens? Your body, what's that?
Go back to the pain.
Yeah, your body starts to become more immune to it. It builds tolerance of it. Right, it builds tolerance of it. And then it's less effective. It's less euphoric. It's less productive in the wellness that you receive from it. Okay? That's normal, because the body becomes very immune to, especially these types of drugs, this classification of drugs. It's your body has such tolerance for it that it's incredible how quickly you can become tolerant. Now, here's another little wrinkle in the matrix, is what happens when you have tolerance. What's happening is your body's getting used to it, so you need more to feel the same, and that's tolerance. But are you becoming physically dependent on it? Yeah. How long does it take to become physically dependent on benzos, opiates, opioids, central nervous system depressants, muscle relaxers, what have you?
Different opinions. Some say 3 days.
I wouldn't agree with 3 days, but you're certainly in the process. You're certainly in the process. Definitely within several weeks. That could be anywhere from 2 to 6 weeks. There's a definite a dependence. The cells start to adjust to that type of drug, and then it starts to need it to function in that way. And coming off of it, absolutely you're going to feel like crap. Now, some people say, yeah, but Dr. Anderson, I need it. I need this drug because without it, I have more pain. And that's where this whole addiction thing and the prescription issues come to mind. And I'm going to explain it in a way you can understand.